I'm the proud mom of a smart and sassy 1-year-old girl. I work full-time as a pediatric speech-language pathologist. My name is Heather Nelson, and I'm a miraculous mama.
Hey everybody, welcome back to the Miraculous Mamas podcast. I'm your host, Elizabeth Joy. I am a certified birth doula, life coach, and have this lovely podcast where we believe in empowering women through storytelling and education. If you're joining us for the first time, welcome. Today's going to be such an amazing episode. May is Maternal Mental Health Awareness, and we have Dr. Ream coming on talking with us. She goes over all sorts of amazing information, and then she also ends up helping me with a few things because I'm just having a hard time this pregnancy. I'm sure a lot of people can relate, but there's just things that you don't want to admit, or maybe you're scared to say out loud. And I talked to her about some of that, and it's definitely a great conversation. And I learned some tools and just some things that I needed to hear. But she's just so amazing. And I've also been using the Mindful Mamas app. I know that I've mentioned it to you guys before, but right now you can have a free month. So I would definitely take advantage of that. I was listening to a meditation the other day on there about pregnancy, and it's about when pregnancy isn't what you expected it to be. And it was just super helpful, and it's been kind of my favorite lately, just very reassuring as well. And it's a great resource to have. So I would definitely take advantage of that free month. You can go to mindfulmamasclub.com/miraculousmamas to get a free month on there. And yeah, they're awesome. And also, I mean, the creator is Tara. She came on the podcast and she's absolutely amazing. And we love her and want to support her and everything that she is doing. Also, I am working on some super exciting stuff. If you guys haven't checked out my pregnancy blogs, I have the week-by-week guide of my pregnancy so far on my website on miraculousmamas.com. Also working on some other pregnancy information blogs, info on there. I just posted a stretch mark cream recipe on my Instagram. If you go to eSandos and you go under pregnancy stuff, it's on there. I've been loving it so far. Absolutely awesome. And I've been just working on compiling blogs, tons of information and resources for you guys. We have amazing guests still coming up on here. Melissa Joan Hart's on next week. June, we're going to have a bunch of dads on. Here's some information from male educators and father figures and stuff like that. So it'll be a really good time. I hope everyone enjoyed their Mother's Day last week. I know I said before, I feel like I can't really celebrate because I'm not really a mom yet, and just this pregnancy's been weird. So, but I mean, we did. Vito brought me breakfast in bed and was super sweet, and we did our own little thing. But it was a good time. But I think next year will be where it is really at, you know? I feel like next year it'll be a lot easier to say, hey, I'm a mom and I can celebrate now. Also, I know since it is Maternal Mental Health Awareness, don't forget to check out the BetterHelp app as well. They are awesome. It is a resource that I have been using, and they're a good resource. It's not only maternal mental health, but just mental health awareness in general this month. And I know that with quarantine and coronavirus and just different things going on, that like stress levels and anxiety and I mean, just even suicides, things like that have skyrocketed. So it's never be ashamed to reach out just to talk to somebody, to get an opinion, or to just have somebody outside of your family or friends that you can confide in and who can help you through stuff. And that is what BetterHelp does. If you go to betterhelp.com/babies, you will get 10% off your first month. They make it completely confidential. Like I said, I have been using it and I've found it very, very useful for me. So I just wanted to share that with you guys again. For anybody listening who may want to check it out. But you guys, Chicago weather's crazy. I mean, finally it reached like 80 maybe. Well, actually, it hasn't reached 80 yet. It's going to get closer, but we've had a couple days in the 70s, which is a good sign. But I'm just really excited for warmer weather. I've been walking outside every single day, whether it's 30 degrees or warmer, but I'm really excited to soak in the sun and get some warmer weather and just feel the life breathing around me again. I know some of you guys can relate. I'm super excited, like I said, about today's episode. I'm going to go ahead and grab Dr. Ream and have her just talk to us about this really important topic of maternal mental health and why it is so important to continue this conversation. All right, everyone, I have Dr. Ream here, and she's a licensed clinical psychologist with advanced training in perinatal mental health, and May is mental health awareness. And so I wanted to get a professional on here, and I've been following her on Instagram, and she just puts out amazing content. So I'm so excited that you are here with me today, joining me.
Thank you. Thank you so much for having me.
Yeah, I'm super excited. I'd love for you just to tell us a little bit about yourself and what made you want to even get into this field.
That's a great question. I get that one a lot because it's, and you know what? If you would have asked me this 5 or 10 years ago, I would have thought, no, I couldn't see myself doing this. Why would I be doing this? I am, like you said, a licensed clinical psychologist, and I've kind of done a lot of different work. And before I landed here, I was doing eating disorder recovery work. I was a health psychologist working in a healthcare system. And my world kind of shifted upside down, I guess you'd say, the first time I became pregnant. So I have experienced a couple of miscarriages before I had my now son. So things started off really rocky for me. So I had a lot of feelings come up. And throughout my pregnancy, I was experiencing this anxiety. And then postpartum, I was just not feeling like myself. So I didn't expect these really big emotions. And I had really, I wanted this baby so bad. And I thought, how could I be feeling all these feelings? I'm happy. I want this. So that really kind of nudged me to look into perinatal mental health. And it was crazy to me. I went to my first advanced training, and the speakers were talking, and I was like, oh my gosh, this is what I've been going through. This is what's been happening. So I really made a pivot in my life, and I've never looked back. It's the greatest gift to be able to work with moms and to reassure them and validate them and support them in their journey.
Mm-hmm. Well, it's very true that like moms make the world go round because, if you're we're reproductively responsible for, I mean, you just need some sperm. You don't even necessarily need a man. and we are like the life givers of the world. So women need that support.
Absolutely.
So much.
Absolutely.
All right, guys, I'm super excited to tell you about one of our newest partners that I absolutely love, and that is Cacao Bliss. It is an indulgent chocolate made from sun-kissed cacao beans and a blend of power-packed ancient superfoods, including turmeric, MCT oil, coconut, Himalayan sea salt, cinnamon, and black pepper. You can mix it into warm drinks, cold drinks, smoothies, even baked goods. I just got a recipe book for all the exciting things that I can use it for, which I am pumped. So far, I've only had it in beverages. And let me just tell you how amazing it is, because I've had a sweet tooth lately, but I still try to not go overboard and try to take care of my body since I'm growing a human. And this tastes so good. I just mix, so my favorite recipe is I do a little bit of coconut cream, dash of honey, and then hot water and a heaping scoop of the Cocoa Bliss powder. And it is so delicious. It helps remove those cravings for wanting more, boosts your energy, and it's guilt-free chocolate. Who doesn't love guilt-free chocolate? And my favorite property of it is it reduces inflammation with one simple drink. I know that I've struggled with inflammation in my body, and anytime I read that something reduces inflammation, I'm always like, sign me up. But this one comes with added benefits. It's like a friend with benefits. You reduce inflammation, but I'm getting this awesome, delicious chocolate drink that is amazing. Cacao Bliss right now is also offering you guys up to 46% off and a free electric frother when you use the code MAMAS at earthechofoods.com/miraculousmamas. And the electric frother is like my new favorite kitchen utensil. I absolutely love it. So that's 46% off and a free electric frother when you use code MAMAS at earthechofoods.com/miraculous-mamas. Now back to the episode. So I would love, since it's maternal mental health, I guess, how would you define maternal mental health?
Yeah. So something that a lot of people don't know about is when we even talk about maternal, they're used interchangeably, like maternal mental health and perinatal mental health, they all mean the same thing. But perinatal is this time period throughout pregnancy and even like postpartum, throughout the year postpartum is kind of how we identify it. But most people don't even know that they can have symptoms while pregnant. And we'll kind of chalk that up to hormones, right? Like, I'm just really hormonal. And people will kind of put that on you as well. Like, you're just really hormonal. So we don't realize that these symptoms can start off during pregnancy. And there's a lot of things that can happen even before we become pregnant. Trauma and infertility or miscarriage or whatever, that can also contribute to these feelings. So it happens long before we have a baby. So we kind of have been taught that there's postpartum depression, but this starts long before that. The traumas that we can, experience start long before that. And what we also don't know, and what most people don't talk about, is that it's more than just depression. We now know that there's, depression, anxiety, obsessive compulsive behaviors that we develop to kind of combat anxiety. There's just a lot more that we need to be talking about it a lot more, I guess. And I think that the hard part is that women are not necessarily wanting to come out and talk about it for a couple of reasons. One, they might not know. So part of this is that many women don't even know that they experienced something until it's long gone. And then they can reflect back on it and say, wow, last year was really hard for me. I didn't realize how depressed I was. Mm-hmm. And then the second piece is, like you described, like women were these life givers, but there's these expectations of us that we're supposed to be nurturing, loving, tender. So when we are not those things, and when we're feeling really overwhelmed or disconnected or depressed or angry and rage, we don't want to tell people because there's so much shame that goes around all of these emotional experiences. So we just kind of keep it to ourselves and push through. And that kind of obviously can be really detrimental to our mental health because we're isolated and we're doing it alone.
Mm-hmm. Yeah, for sure. I feel like that's why the conversation is so important and why it's so cool to see it grow so much, because back when my mom was a mom, I remember talking with her, like, it was not talked about at all. There was like no room for the conversation of postpartum depression. It's like, this is what you do. This is what you have to do. And you just kind of get through it. And it wasn't like you're too ashamed to talk about it. And now with platforms, people on platforms opening up, women feel that courage to be able to admit, like, oh, or see the signs like, oh, wow, I experienced that too. And I'm not alone. And knowing that it's so much more common than you think, like you're not alone in it. And so it's so cool, like see the conversations happening, opening up, but there still seems to be stigma around it. And there still seems to be the shame around it.
Absolutely. And I think people that don't know about it think like, gosh, how could she feel depressed? She has everything she's ever wanted. Or
right.
How could she be so stressed out about this? Doesn't she love her kids? And so it's the ignorance, right? It increases that stigma. And it's obviously, it's not like everybody that's saying these things, they might not have firsthand experience, so they don't recognize how impactful their words are. But yeah, there is definitely some misinformation. There needs to be more education, but you landed it like right on, because there are more moms and more women and more people speaking about maternal mental health, which is great. It's just that we need to keep the conversation going because it's such an important conversation to have.
Mm-hmm. Yeah, I'd love to dive into the mom community a little bit because I feel like it's a double-edged sword. So there's these women speaking out and having these platforms, and it's so awesome. But then you also see these women with the perfect lives, and, you know, you get into the comparison, or social media has made it so much easier to compare, to mom shame, to be like, oh, you did that with your kids, you know, and I feel like that, I'm sure obviously that happened before social media blew up, and there's just this huge information overload now. So I'd love to dive into that. Like, how do we even sort through that or deal with it?
That's such a great point. And I actually talk about this in session so often with the moms that I meet with, but it's really tricky because you don't know what you're seeing, and you don't know the reality behind what we're seeing, but there's so many images of a perfect, quote unquote, perfect life, right? Whether it's a mom or not, really, but especially when it comes to mothering and child rearing and the decisions that people are making. And then it's that information overload of, oh my goodness, this is how they put their kid to sleep. Oh my goodness, this is how they feed their child. And how does she look so good already? And it is just any topic, anything you can think of, people are comparing it. And it's really difficult to sift through that information and know that, okay, behind the scenes, this is not exactly what's going on, but this is what people are putting on the internet. Because people are not always, you know, recording their kids having a meltdown, or them in the middle of an argument with their partner, or whatever the case may be. So it's kind of like taking it for a grain of salt. And, you know, we hear this over and over. This is just the highlight reel. This is just the highlight reel. It's almost something that we need to remind ourselves of. But something that I talk to the moms that I meet with, and I actually just tell myself this as a human being, is that we need to set really good boundaries with what we consume. And that's everything. You know, we talk about how we can better nourish our bodies with food. And that goes for media. Like, what am I going to take in? What am I going to let my eyes see? That is it going to make me feel better, or is this going to make me feel worse? So if it's social media, do I need to unfollow people? Do I need to limit what I can see? Are there particular people in my life that I see and I meet with that I might need to distance myself with for this time? Because this is just, it's not working for my mental health. And it's okay to choose your mental health, because you are making the world go round in your world. So it's just so important to do that. I had to do that as a mom, especially in those newborn days. I was just like, this is so overwhelming. All of the options, all of the everything. I'm going to go ahead and, you know, cleanse my social media and my life. And I'm just going to limit what I take in for just because I need to protect my mental health. And it's incredibly important to do that.
Yeah. Yeah. No, absolutely. I feel like everybody has an opinion about everything. And I don't know what it is about women and moms that feel like we always have to share it. You know, it's like always a comparison. I've even noticed just like in being pregnant, you know, talking about, so I've struggled with insomnia throughout my whole pregnancy. Since I was 5 weeks pregnant, I like crazy dreams and just haven't slept well. And like, whenever I share that, whoever you're talking to is like, oh, well, wait until this and wait until that. And it's like, just validate me. Okay. Like, just be like, wow, that really sucks. And be like, yeah, it does. You know?
It's so true. I post a lot about this, and it's funny. I get I get some DMs and some comments of, well, I guess you just don't want to know the truth. And it's like, well, you must be that person giving out that advice.
Because you know the truth.
But it's so true. Like, it doesn't matter what stage. And you're absolutely correct. When it comes to parenting, especially pregnancy, everyone will tell you about the next thing that was so like terrible for them, or it's just going to get worse. You just wait. And it is invalidating when we are struggling. So sometimes, depending on who the person is,
right,
it's telling them, being outright and saying like, I don't need you to give me another scenario. I just need to be validated right now. I tell my husband this all the time.
Yeah, same.
I just want to talk to you. I don't need you to fix it. I don't need you to give me a solution. I don't want you to, tell me what's really working well. I just want you to hear me. So that's part of it. And the other part is people just, when they don't have something to say, it's just almost better to share their particular experience. And I know that not everyone maliciously wants to one up or, offer you the piece of unhelpful advice. But really, it is good to set the boundaries with those people, but then also taking it with a grain of salt and knowing that, okay, this is just not going to be the person I'm going to come to for my, social support that I need. And that's what you start to realize in this journey is you go to different people for different things. If I want somebody to fix things and give me solutions, I'll go to my husband. Mm-hmm. If I know that I have I need to just talk and vent, there's going to be a friend that you can just do that with and feel safe. You want someone to distract you, that's going to be a friend that maybe you can, when we're not, experiencing this world crisis, go out and do stuff with. Mm-hmm. But it's just finding out what you need and how you fill your cup differently with different people in different groups. So it can be incredibly helpful. And if you find that right, mom group, that mom support, it can be so helpful because if they're all experiencing very similar things in the similar walk, they're not going to be invalidating you and saying, you just wait. They're going to be like, yeah, you're right. That does suck. Mm-hmm. And part of it is educating people. I mean, I try to do this as much as possible. We don't want to minimize or invalidate. We want to just say, I hear you. I'm here with you. This is hard. Mm-hmm. You're right. That's what we want to hear, right? We want someone to tell us this is hard. There's no way around it. I've been there and I know it's hard, but it's true.
Right. Yeah. Yeah, absolutely. And I feel like that's also why I love having these conversations, just because I've learned so much too, because I know that there's a lot of times where somebody's going through something and I know for me, it's I want to have the perfect words to say, even comforting somebody who's dealing with loss or whatever. And I've just realized being I'm so sorry. Let me know what I can do. If there's anything I can do for you, or I don't have the words, but I'm here, just being I don't, what comforts me is not going to comfort somebody else. And just showing up, I've realized is way better than giving an opinion.
Absolutely. Yeah. Cause what I struggle with is going to be different than what you struggle with. Right. And what comforts me is going to be different for everybody else. So that's why it's just really hard to give those opinions and that those statements to people of you just wait, because maybe that next season is not going to be so hard for me. Mm-hmm. And what's hard for me, just because you're going through something hard and I'm going through something hard doesn't mean that one's better or worse than the other. They're just both hard. Mm-hmm. And we can just leave it at that, right? Pregnancy is hard. Yep. Child rearing is hard. They're both hard.
Right.
And that's okay. They can both be.
Yeah, for sure. All right. We're going to take a quick break to talk about how we all want to do the right things for our health in the long run. And it's really hard to be perfectly healthy. Even if you're eating salads, smoothies, everything that you can do to be healthy, we're still not getting all of the essential nutrients that we need on a daily basis, which is why I love Ritual, because it is an obsessively researched vitamin for women. And they have the nutrients most of us don't get enough of from our food, all in their clean, absorbable forms. There's no shady additives or ingredients that can do more harm to your body than good. The reason that I chose to go with Ritual is because I love transparent companies. I love that I could go on their website, that I could look up the ingredients, I could see where they are sourced from and everything that is in it. And I knew how to pronounce it, which was cool. And they are just an awesome vitamin company, especially since they did all this obsessive research for women, for our bodies, and I've been taking them for months now, and it's definitely an amazing added benefit to my daily life. They have prenatals, they have daily ones for women, that's essentials for women's. They have awesome stuff on there. From vitamin D to omega-3, they're essential for women, help fill in the gaps in your diet. My other favorite feature is the no nausea capsule design. It's gentle on an empty stomach. There's a mint tab in every bottle to keep things fresh, so you don't get that fishy aftertaste, which is common with a lot of omega-3s. Can I get an amen? Because that's honestly one of the things that has kept me using them, because I have major acid reflux right now with my pregnancy. I burp up everything, but these are the only pills that I actually don't burp up, and there's no weird aftertaste, nothing like that. They actually kind of taste refreshing because of the peppermint tab in there. They also have a subscription that's easy to start, it's easy to snooze, and it's only $1 a day to have the essential nutrients that your body needs delivered every single month. No strings attached. Better health doesn't happen overnight. ladies. And now Ritual is offering the listeners 10% off your first 3 months. Fill in the gaps in your diet with Essential for Women, a small step that helps support a healthy foundation for your body. Visit ritual.com/mamas to start your ritual today. That's 10% off during your first 3 months at ritual.com/mamas. Now back to the show. I'd love to talk about mom guilt a little bit because I feel like that also goes into self-care. I was reading one of your blogs talking about how self-care is not an option, right? It's something that you need. But when you hear so many moms and you're like, what do you do for self-care? And they're like, haha, yeah, right. You know, like that doesn't exist. So I'd love to talk about kind of getting rid of the mom guilt and why it's so important to have self-care.
Absolutely. Mom guilt is a big one. I wrote a blog post. Mom, I feel guilty about everything. But that's the theme of all of my therapy sessions. It's like, I want to take care of myself, but I feel so guilty about it. And at the root of guilt, so guilt and shame, we all kind of use those interchangeably. And guilt is really, truly something that's about me relating to other people. Like I feel guilty that I'm doing something and it can harm others. And shame is I feel bad about myself. So like I feel bad about being. Guilt is I feel bad about doing. And they can be helpful. They can be helpful emotions because obviously if we're doing stuff that's off track for who we are as people, then we should kind of keep ourselves in check and say, oh, that didn't make me feel good. I shouldn't have done that. That was hurtful. However, when it comes to mothering, it can be really unhelpful because we start to feel guilty about things that are silly. And if somebody else were to tell you, I just feel so guilty I took a shower alone. You'd be like, what? I feel so guilty. I ran out to the store by myself. Or, I had a date night with my partner and we left our baby alone with a sitter. And you're just like, why do you feel bad about that? Like realistically and rationally, we can hear it sound irrational for other people, but for ourselves, like we've got this hardwired to feel bad about. So part of it is recognizing how silly it is by keeping track of those thoughts and like thinking to yourself, well, now if somebody else told me this, how would I feel about it? And why do I feel so heavy about this for myself? Am I holding myself to a standard that's unrealistic? And where did I set the standard from? So I have a course that I teach all about this, but we talk about setting expectations and where we learned those expectations. Is it from, my mother, my grandmother, from social media, or the moms around me, or TV or whatever? And it's kind of like that's where we start to create these expectations of where we should be. And if we're not, we have all this guilt about, gosh, I should be doing more. I'm harming people. But when we get in the practice of taking care of ourselves and allowing ourselves to do that by really challenging those, guilty thoughts, like I should feel bad about this, and we challenge ourselves to do something good, we can be a better parent and a better person. I recognize this in myself because everything I talk about, I practice what I preach. And it's funny because my husband was just saying this yesterday. I was like processing a thought and he goes, oh my gosh, isn't this the kind of stuff that you post on Instagram and you're telling yourself to do it? And I'm like, yeah, this is real. This is real. This is just real therapy on myself. But if I don't take care of myself, I'm irritable. I just am really short. I'm like touched out very easily. If I take any bit of time to myself, I find that I not only can be more productive because it's not always about productivity, but I can be compassionate. I can be, tender and giving and all the things that I want to be as a mom. So self-care is not what we think of necessarily like via social media. And that's the part where moms get slipped up on. So I feel guilty about, obviously we talk about that, but self-care doesn't have to look like what, so-and-so on Instagram does. It doesn't mean I'm soaking in the bath and, drinking champagne and being fed strawberries. Although those are great and you can absolutely do those things too, it's not the reality for my life right now. And I've come to accept that my self-care is something different. So I always tell the moms that I work with, create a catalog of things that you can do at maybe even 15 minutes to an hour. I mean, if it's 2 hours, great, whatever that looks like for you. And start to do those, incorporate them in your day-to-day, and then see how you feel before and after.
Yeah.
And maybe something didn't work for you. That's fine. Move right along. even if it's sitting outside and let the sun hit your skin. You don't want to do that in Phoenix right now. It's really hot. So, but like figuring out what works for your schedule, what works for your family, and doing those things more regularly and checking those thoughts that are really bringing on the guilt and starting to challenge them and see where they're coming from. You know, where is this hardwired and how do I stop this tape from playing repeatedly?
Yeah. Yeah. That's so hard. Cause I feel like, so I'm dealing with like a little bit of mom guilt, even though I don't feel like I'm a mom yet. And I'm sure that's normal because I don't have a baby yet. But like just even in the pregnancy, I feel like I've had a really hard time bonding with the baby. Mm-hmm. And so like, I already feel guilty over that. Then I'm like, am I going to be able to bond when the baby's here? You know, like I feel like the more movements I get, it's like, okay, this is real. This is, you know, like, okay, I'm pregnant. I'm going to be a mom, but I don't feel like this big bond to my baby yet. And like, I don't know if that's normal. I don't know, like, does that, like, I already feel like that makes me a horrible mom, you know? And it's like, I'm not even like, so I can see how overwhelming it can get almost before you even have a kid. Mm-hmm.
It's not uncommon. So bonding, even in the 4th trimester, moms will report, I'm having a hard time connecting with my baby. And that is one of those myths of motherhood that people think that you will instantly connect with your baby in your pregnancy. I get so many moms that this is what they come to me about their pregnancy and their postpartum experience. And they feel guilty because they don't want to tell somebody that, man, even 1 year, my child's a year old and I don't feel as connected as I should be, quote unquote. And it's a lot of it. You have to think about this. We have to put in the work. We're meeting somebody we've never met before.
Yeah.
And for some people, they can, you know, instantly do that. And for others, it's like, I got to warm up to you. I don't know about you quite yet. So I really recommend when you're pregnant, creating time to bond. Mm-hmm. And it sounds silly to some people, but like carving out very intentional time where either you're speaking to your baby, you know, you're rubbing your belly, and as you move along in pregnancy, like counting kicks and being, you know, mindful of that, but just being still with your baby and kind of just being present. Some people will sing to their baby and it will seem very odd at first. And but you'll notice that creating this pattern of just being, if it's like holding your belly and like rocking together or talking or reading a book, or journaling even. I do find in pregnancy, some women will have a hard time bonding because of fear. I had this personal experience. I had a very hard time connecting to my pregnancy because I had 2 losses before I got pregnant with my son. So my fear always was, if I bond or if I connect this pregnancy, I'm letting my guard down. And what if something bad happens? You know, I don't want to be vulnerable again. So it's a really hard, it's like a radical acceptance of what's happening. And I didn't want to because I was so scared. Like, what is this going to mean if I bond and then something terrible happens? I had this fear moving through that whole nother like perinatal anxiety that I was experiencing. And it wasn't until I heard him cry that I thought, oh my goodness, this really happened. I can't even believe it. You know, we've got some catching up to do. But it can be really hard when there's a lot of, you know, fears or anxieties or just a sense of disconnect. And maybe your world is busy, but creating that time and allowing yourself to connect and to speak on that fear. Every day I had these mantras, and the biggest one that I would share with myself every day was, okay, today I'm pregnant, and for that I'm grateful. Today I'm pregnant, for that I'm grateful. Every day I'd wake up pregnant and I thought, oh, okay, it's another day. We're another day closer to meeting. And it's a skill. You have to work on it like you work on any other relationship. And I really want to dispel the myth that everybody just naturally bonds immediately. That's not true. And it's not the case for quite a few moms.
Yeah. No, that's definitely comforting to hear, because, you know, it's hard when other people are like, oh my gosh, da, 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 and you're like, yeah, I'm pregnant.
You're absolutely right. Yeah. Isn't it great? And you're like, for sure.
Yeah.
Really enjoyed those.
Well, I was reading too. So, and you said at the beginning that you used to work with recovering eating disorders and stuff like that. And I've talked very openly on here. I struggled with one for 13 years and I've been, it's been awesome. Like 4 or 5 years ago, I found healing and I haven't struggled at all. And I didn't think I would in pregnancy. And I'm not struggling with, like an eating disorder, but I am struggling with my body changes. And I just really didn't think, because I did so much work to love and accept who I am, And so now with my body changing, it's like I look in the mirror and I don't know who I am. So that's, I feel like, another thing that I feel guilty about. Like at my last appointment, like I don't weigh myself because I don't really care. I'm like, it's for me, like I've learned over the years, it's about how I feel. Like and then I got weighed at my last appointment and I saw a number on the scale that I haven't seen in years. And I was like, holy shit. I like how, my midwife was like, don't even look at the number when you come in. Don't worry about it. And she doesn't even know like my history, but it's like, I feel like that's another thing that I'm struggling with. And my husband and I were talking and he's like, I'm really surprised that like, you're struggling with it because I'm so like embrace everything of who you are. And now I'm like, I don't recognize my boobs. I don't recognize my like stomach, so it's definitely been really hard. So I was wondering if you could speak to that a little bit.
This is another one that comes up so often. I mean, I'm a woman, so I had a baby and I felt all the changes. And I remember even postpartum feeling like I don't recognize this person. I went from being an athlete to just not feeling like I could even hop a step without catching, losing my breath. So I felt, and it's been a process. And I was like, tell people that body image, it's a journey, right? We're not like, nothing is going to change so swiftly overnight. And the process of having loving kindness for our body it can be so difficult on some days and easier on others. For a lot of the people that I work with, we talk about, how can I minimize like triggers for just the body image piece, like even body checking, because when we don't even realize that we can be body checking, what does this look like? What does this feel like? So obviously some people will want to expose and they want to like see all this stuff openly all the time. And they think that like exposure is the way to go. But for me personally, and for the moms that I work with, what I do know is that if I can minimize my exposure to some of these triggers, I will feel better about my current experience. And that's not to say like I want to live in denial and I'm not going to, I'm having such a traumatic experience looking at my weight. But for me, I didn't look at my weight not one time throughout my pregnancy. And I asked my provider not to show me. So that's the one thing I would tell. And I actually used to tell this to my clients when I used to work in eating disorder recovery. If this is something big that is going to set something off, and even however little it sounds like, oh, well, it's not going to impact me in a big way, I could ruminate about this for the rest of the day, or the rest of the week or the rest of the month, like thinking about that. So I would ask, please don't show me my weight. So they would either cover it or I would do a backward weigh-in. And I never, ever knew. I did not know at all throughout my entire pregnancy. So people are like, how did you live? What's this been? like, believe me,
I lived just fine.
Yes. And I also, so some people, like I don't look in the mirror. Like if you get out the shower, like if we're talking about reducing stressors, if this is really stressful, just looking in the mirror and staring, if it's going to impact you negatively. So just whatever it is that is a trigger for you that, like this is really harmful to my mental health and my mental space. Like what can I do to minimize those things? That's the first thing I would suggest. Another thing is, how do I create compassion for my body? And, we talk about gratitude. You hear about this all the time, but it's how do I have gratitude for the little things? And I don't mean like, oh my goodness, I have gratitude for my body that's growing this baby. Because people will say that, right? And you might not be able to connect with that. So it's figuring out what can I connect with. I heard something today that I thought was really inspiring, but somebody it's actually a Peloton instructor, and I love her so much, but she speaks to my soul. She said, if you're feeling like you're losing your breath a little bit, she said, it's a privilege to lose your breath a little bit. And I thought, wow, that's just so inspiring to me, because these little things that I have, like my breath or feeling out of breath or being able to walk or not have any pain today or whatever that looks like, how can I honor that and be grateful for those things? And just finding out what and how we can be grateful. There's a book, it's not related to pregnancy, but it's about being more self-compassionate. It's called Self-Compassion by Dr. Kristen Neff. And I love that book. I recommend it to almost every single one of my clients. And it just really speaks to how we talk to ourselves, how we comfort ourselves. And I think it's really helpful to be more self-compassionate. So that's something that I really encourage every mom, every woman, everybody that I speak with.
Mm-hmm. Yeah. No, I definitely think I actually have an appointment tomorrow. I'm just going to say, don't show me my weight. Because it's weird, because I felt like before this, like I didn't care. Mm-hmm. I don't know. Like whether I gained a little bit or lost a little bit, it wasn't a thing for me,
Right.
But your body changes so much. I remember when I was like 13 weeks pregnant, my nipples started changing. I'm like, nobody told me that like my nipples were going to start changing this early. Like I knew there would be changes, but I'm like,
Right.
the color, the shape, the size, like it's already starting. Like what the heck, and it's like,
Yes.
oh, and nobody else was talking about it that early. So then you do think about like, is this normal? And, you just do definitely go through all of those scenarios in your head. But I think also knowing like so much of this is normal. Like so many people do struggle with their body changing because you're used to your body being a certain way. And then all of a sudden and you have no control over it. Mm-hmm.
Mm-hmm.
There's no control of what is happening to me right now.
Absolutely. That's a definite piece. Like motherhood will, especially for people that enjoy control. And I know some people are really relaxed. I was just I need to know what's happening. So the unknowns really can mess with people. And it's hard because you're just like, here pregnancy, here motherhood. I'm giving you all of my control and any semblance that I ever had of, predictability, and I'm going to hand it over to you. And it's really hard to wrestle with. I will say though, like the body image thing, our body image changes, right? It can wax and it can wane. And you know that throughout the course of your life. And it might not feel like enjoyable, the changes that are happening right now, but knowing that I can regain some of those good feelings that I have about my body. And I don't expect everybody to just like absolutely love their body throughout pregnancy. And I get that. And I'm not going to even, sprinkle anything really boo-boo on it and say you have to, and you have to love all the changes. That's not real. So I think just meeting yourself where you're at and saying, okay, this is happening. But you know what? It's not going to always be like this. Mm-hmm. And I can manage that. Mm-hmm. And I'm going to do whatever I need to do to reduce some of these triggers.
Yeah.
But I don't have to be like, oh, I embrace everything and it's so glorious and beautiful. Like you don't have to do that. You don't have to live your life like that. Mm-hmm. It's okay.
Yeah.
It's okay.
Yeah, no, for sure. I would love to talk about, so you have a course, Keeping Mommy in Mind, on your website. And I'd love for you to kind of share with us what that's about.
Well, thank you. I created this course because I thought like everybody would need access to this as a new mom. And I created this course because I recognized there was like such limited resources, and I'm only one person. So if I have a full caseload and people are contacting me all the time and I'm thinking, oh my gosh, how am I going to help people? How can I do this? So it's a self-paced online course. And so you can, obviously it doesn't expire. It has a workbook that has roughly 50 pages. And then there are these modules that you would go through. So the first one being like transition to motherhood. And it's going through like a lot of the myths of motherhood, the expectations that we might set, feelings of loss or grief that we might have that come up, whether it's about our body or whether it's about just our identity or whatever that looks like. And going over a lot of those just big emotional experiences that no one talks about, and then we have them and then we're feeling lost. So that's how it starts. Then it goes into all of the perinatal mood and anxiety disorders, and I describe them all. And I give examples of what that looks like. And then we move into how you can improve your mood with evidence-based therapy skills. So all the skills that I teach my clients, I teach in the course. And then there's a section for relationships where you can work with your partner to discuss communication, conflict resolution, as well as increasing intimacy. There's a whole section on breastfeeding and mental health and how those interact, sleep and how to get better sleep, practical ways. I'm not a sleep trainer or educator. These are just how you can manage your environment to get better sleep. And then how to build your social support system. So it's a really comprehensive course. It's self-paced, like I said, and there's a Facebook community that's also associated with the whole course. And it's been an incredible resource. I've got such great feedback about it, and just poured my, this is so cliche, but I poured my heart and soul into it. It took like 7 months of creating the course based on research. So I'm really proud of it and getting some pretty good feedback.
Yeah, that's awesome. Yeah, I was browsing through it earlier and I was like, this looks really cool.
Thank you.
And I feel like another thing that a lot of moms struggle with is justifying like spending money on themselves, like going to a psychologist or getting help or, like getting a course that could really, really benefit them. It's like, if it's a cute outfit for the baby, forget about it, or it's whatever for the baby. But then when it comes to an investment for self-care or for mental health, I feel like a lot of women have trouble like justifying spending that money on them. I don't know if you have any advice for people who are like, I really should probably have help, but I don't feel like I can afford it.
This is such a common theme, and moms are the worst at taking care of themselves. And you think about like how important it is if there's a whole family, or if there's, dynamics of children and their well-being stands on my health and my mental well-being. How effective am I if I'm not taking care of myself, right? I am not only miserable, but I'm just not going to be effective because I don't have the bandwidth. So, you hear these analogies of you can't pour from an empty cup. But I think about like if you were driving your car and it completely ran out of gas, what would you do? You wouldn't be like, well, let me just leave this here. If you need to get from A to B,
right,
you're going to pour some gas into it so you can go the distance. And if like this were a health condition, like if you had diabetes or something like that, and we talk about, if you needed insulin, we would go get that. And it's kind of the same thing. This is a necessity. It's a need. It's not that we are doing these are not luxuries. They are how we care for ourselves so that we don't break down. So it's not like our whole system just falls apart. And we show our kids and we show our family and the people that we care about what it looks like to care for ourselves. And that's a skill that I wish my mom taught me when I was growing up, because she didn't. And it's been a hard thing to learn and unlearn the stuff that I don't want to do, So it's definitely something that we got to think about. What I'm doing is on display. And I want to be sure that the people I love and I care about and I'm leaving a legacy for and, really showing them and teaching them what's important in life. I want them to know that caring for themselves is so important, because it's more important than just caring for everybody else. Because I don't want to raise little people that are constantly only caring about other people and neglecting themselves. So that's just how I guess you'd say justify it or make it well. But I know that this is something I have to do for myself to make this engine keep going. So that's something I have to really continue on.
Yeah, no, that's a really good analogy. So outside of your blog, what are a couple of your favorite resources for perinatal mental health?
I love Postpartum Support International. It is a large organization, and they're going to be posting so much for Maternal Mental Health Awareness Month. But they have a directory of providers, and that goes for therapists, psychiatrists, online support groups that are free. They just have every resource, and that's where I kind of send every person to. Postpartum Support International. It's postpartum.net. Postpartum Stress Center is also another resource with a directory of providers and great resources as well. And those are typically the two places that I send people that are looking for help. If anybody is pregnant after loss, there's a Pregnancy After Loss Support, PALS, and that's another great resource I found in my own experience. March of Dimes for preemie and NICU moms. and parents, I'm sorry, but there's just a ton of resources. I try to post about this regularly. I actually do have a resource page on my website. I'm trying to think of, do I really have one? Yeah, I do. A resource page on my website with a lot of those resources too. So it's a good place to go and check that out.
Yeah. And there's a lot of, on your resource tab, just like some free downloadable things on there as well. So guys, make sure that you definitely check her out at Psyched Mommy. Wait, did I say that right?
Yeah.
Okay. Psyched. Then I'm like, wait, was it Psyched Mommy? Cause she's constantly posting stuff like on her Instagram and things like that as well. And then that's your website as well, psychedmommy.com.
Correct. Yep.
Awesome. Thank you so much for taking the time to come on here and to just talk through all of this, because I know that, I mean, any mom that you talk to has struggled on some level at some point in time.
Absolutely. And if they say they're not, they're lying. I would say you don't want that mom friend. No,
right. Yeah. And I feel like that does make a difference, is finding the people that, like you said, like having your friend that you can cry with, or who's just going to listen, and having that person that is like, helps pick you up or inspire, I feel like there are different roles that different people play in your life, and that's okay too. Like, you don't have to be like, I don't know how to word it, I guess. Like,
not one person's going to fill all that stuff for you.
Right. Mm-hmm.
So yes, just like your partner can't be all those things for you, but yeah.
Mm-hmm. Yeah, for sure. Well, thank you again so much for coming on. Everyone, make sure you go to psychedmommy.com, and I'll have all of that in the show notes. And I mean, a happy Mother's Day to you, and happy Maternal Health Awareness Month.
Thank you so much.
Yeah, you're welcome. And we'll talk to you soon.
Sounds good.
She is awesome. Definitely go follow her on Instagram, because she has tons of information on there that she posts all the time. And I find myself reposting her stuff a lot and sharing it, because she's just so knowledgeable and just hits the nail right on the head when she's talking about some of these topics. I'll read something that she posts. I'm like, oh yeah, that's so good. But I hope you guys enjoyed today's episode. If you're listening to the podcast and you're not subscribed, hit the subscription button, share this podcast with somebody that you know would love it. And if you think about it, on iTunes, leave us a 5-star review and tell me why you love the podcast, if you've been enjoying these interviews. And again, thank you so much for your time. I know time is so valuable right now. And thank you for taking the time to listen to this and to be a part of this community with me. If you're not a part of our Facebook group, go ahead and head to Miraculous Mamas on Facebook and join us there. That's where we ask tons of questions, continue conversations, and where I get a lot of my advice, like things for my registry and different things like that. Also, make sure that you're following the Miraculous Mamas Instagram. Check out the Miraculous Mamas website and the Twitter. I love you guys. Can't wait for you to hear the interview next week with Melissa Joan Hart, and I will talk to you soon. Bye.